very good morning to all of you. Thank you so much for joining us on this Sunday morning. My name is Dr. Sadaf Imtiaz. I'm one of the teaching coordinators here at UKRST. And I'm very thankful to all of you for joining us today, and thankful to our speakers for this webinar today. And I really hope you enjoyed and take away some valuable insight to navigate your radiology ST1 journey. While we're waiting for a bit more people to join in, I would like to introduce UKRST and its members. So, like I said, I am one of the teaching coordinators, and then I have one other teaching coordinator to help me. That's Maggie. And then we have our two very creative social media managers. Both of them are here, Dr. Baram Said and Dr. Nuris. Then we have our core committee members. First is Dr. Angelica. She's also here with us. She is our events coordinator lead. Then we have Dr. Dalia Idris, who is our digital content lead. She's here with us as well. Thank you to all of you. And then we also have Dr. Shoaib Shafiq, who's not here, but he's our representative. Finally, our founder is Dr. Asim Khan. He's a consultant neuroradiologist at the Lancashire Teaching Hospital. And we have our chief organizer of UKRST, Dr. Abira Khan, who is here with us. She is a consultant neuroradiologist at Oxford Teaching Hospital. Abira, would you like to have a few words?
Hi, thank you, Sadaf, for the introduction, and welcome everyone for this Radiology ST1 webinar. So about UKRST, this was founded more than 6 years ago by my colleague, Dr. Asim Kabli. We are a voluntary organization, and we have helped lots of radiology aspirants to get into radiology. Over the past many years, we have arranged ST1 mocks and also ST3 mocks for the induction into radiology. And previously, it all used to be free of cost. It is still free of cost for us because we don't, even if we are charging any money these days, it's all a voluntary organization. So whatever the little charge we take from the mocks, it is all funded into charities. We also help candidates for fellowship applications. So in the coming years, if you're going up for the fellowship interview, just get in contact with us, and we also help with the fellowship interviews. We also help with the consultant interviews and also help applicants for the CSER applications. We do have our Facebook group, a Twitter page, and also have an Instagram page. We have recently inducted teaching fellows and also social media managers who are doing more teaching presentations. So if you have any radiology project that you want to be associated with, and if you want to do a national project, just get in touch with us, and hopefully we'll get some more members on board, and then you can do a national project. So today this webinar is more focused towards your ST1 year. I know it's very daunting when you start off because you're coming from different specialties and you have no idea. But honestly, you will really enjoy the whole journey. I have recently completed my training, and I'll be starting my consultant post from tomorrow. And the time just flies off really quick, and you just want to get the most out of it because the learning curve is very steep in radiology, and you will realize that in the first few days or weeks if you have already started, or if you have not and you're going to start in September. So best of luck for your journey, and hope you enjoy the session today. And off to Numres.
Before we move on, thank you so much, Abira, for that. Just a couple of housekeeping rules just to keep this webinar run smoothly. So all the videos and microphones, we'll have them turned off so that just the speakers who are giving the presentation are visible and we can hear them properly. You can use the chat box to put in your questions, your comments, whatever you want to put in and whatever you want to communicate, just put in the chat box and we'll pick it up from there. We'll try to answer questions as we go in the chat box, but if any of the questions remain unanswered, we will pick them up. And at the end of the entire presentation, there will be a Q&A session, and we'll try to answer as many questions possible. This webinar is being recorded, so just be aware of that, and it will be edited and put on to the YouTube channel of UKRST. Finally, at the very end, we'll share a feedback form. It will be great if you can just fill it in. It will help us improve, and also we will be able to issue certificates just based on that feedback form. So that's it from me, and I'll just hand over to Numris, who can introduce our very esteemed speakers to all of you.
Hi guys, my name is Nimris. I'm one of the UKRST social media managers, and I'd like to introduce our wonderful speakers for today's webinar. So firstly, we have Dr. Salmana Rain, one of the ST2s in Leeds and West Yorkshire. Next, we have Dr. Jaren Varghese, also one of the ST2s in West Midlands. And then we have Doctors Gian and Dr. Nutt, both ST2s in Thames Valley. And then we have Dr. Afan, who's a ST2 in Thames Valley as well. And then lastly, but certainly not least, we have Dr. Jay Cowan, one of the ST3s in Wessex. Thank you. So maybe if we start with Salman, if he's ready.
Hi, yeah, can you hear me okay?
Yes, we can.
Yes.
Yes, hang on. We just need to shift the spotlight to you 1 second. So, okay, great.
Can you guys see my screen?
Yes.
Fine. So thank you for the introduction. As mentioned, my name is Salman. I'm one of the ST2s in Leeds. Firstly, congratulations everyone for getting into radiology. It's a big achievement. So I'll be starting this webinar by giving you a short talk on an overview of how to prepare for ST1. This will be followed by some fantastic talks. So stay tuned and hopefully you'll take some valuable points from this. So I basically want to focus on two important things. Firstly, what's expected from you as an ST1 and how to make the most of it, essentially. So this is just timeline of the main things that will, main events that will occur in ST1. So you start off ST1 in August. Places like Leeds, you'll start in September. And then you begin to lay some basic foundations, which we'll talk about in the next slide. In December is when you start seriously studying for the FRCR Part 1, which will, for us, it was first week of March. I'm not sure exactly what the dates are for this year's, next year's exam. And then once you're done with the exam, that's when you start focusing on actual radiology, working on your diagnostic skills. And then in June, you'll have some in-house exams, which again, you'll have a talk on. Most importantly, enjoy the learning process. And this year is the year where you'll have minimal expectations. So talking about expectations, the main ones for year one are firstly, passing the FRCR Part 1 exam. It comprises of an anatomy and a physics paper. There'll also be some in-house exams, as I mentioned, on plain film, CT, ultrasound, depending on your deanery, but you'll have some talks on this shortly. Secondly, building a strong foundational knowledge, which includes principles of different imaging modalities, like how the scans are obtained, some artifacts that you may encounter, which as a consultant, you have to troubleshoot and work with the radiographers to resolve the issue. And you also need to grasp good understanding of the radiological anatomy, as well as learn how to start vetting scans when they are requested. You also need to start working on interpreting basic imaging, which includes plain films of like MSK, chest, common CT scans that we encounter on a day-to-day basis, like CT heads, chest, CTPAs, CT abdo-pelvis, CT angiograms, as well as getting a basic understanding of MRI, what scans we do, mainly for quad equina syndrome scans that you'll encounter during your on-calls. You also, at this point, start practicing ultrasound and fluoro. Essentially, in radiology, from my 1 year's experience, you need to build up a library in your brain of the normals and common pathologies, as it's just the most important thing is seeing as many scans as you possibly can. Then you also need to focus on portfolio. Again, we won't go into too much detail on this because you'll have a talk on this next. And then preparing for the on-calls. This entirely depends on which hospital and deanery you're in. Some start in, I believe, end of ST1 or ST2, whilst others may start their on-calls in ST3 or post the FRCR2A exam. So one tip that I received from my seniors was reviewing the on-call scans the next morning, as I feel that's one of the most effective ways of learning and feeling confident in terms of seeing what kind of scans and pathologies come up that you'll encounter in a year's time. So how to make the most of your training, be proactive, attend MDT meetings. And for example, we have surgical meetings every morning where the consultant radiologist will go through the overnight abdo-pelvis CT scans. This is really good learning opportunity. Also start involving yourself in procedures, because hand-eye coordination is something that you need to develop and it can take time. And what I would say is see as many scans as you possibly can, because naturally you want to focus on one scan and get it absolutely right. But I think initially you want to see as many pathologies or normal scans, again, to build up that library in your brain. You need to focus on part 1 exam preparation, especially during the first half of the year, as that's one of the big hurdles that you need to get through. Then in terms of feedback, so obviously you'll be having a session with either a senior registrar or a supervising consultant. Depending on how busy this session is, some consultants will give you feedback on your reports there and then. Otherwise, if it's quite a busy session, then what I've learned to do is at the end of the session, just go through the reports and see what the consultants reported and what changes, if any, have been made, as this is a good way of learning. And lastly, ST1, in ST1, you've got spare time, especially after FRCR Part 1, to get involved with research, audits, or any other thing that you may be interested in. So moving on from that, I'd like to talk a little bit about managing finances, because obviously as ST1, we may or may not be on shadow on call rota, which obviously means that our salaries wouldn't be the best. But there are ways to get around it. Firstly, budgeting is key, tracking your spendings, making sure that you've got emergency fund for rainy days in case something was to not go according to plan. And thinking about starting to pay off your debt, mainly the high interest debt that you may or may not have. And also it's quite important to save up for the exams, as that's something that we have to pay from our pockets, and it's not covered by the study budget. There are some locum opportunities, not really in radiology, but my colleagues that have locum tend to locum either in general medicine, general surgery, or the local ED department. However, there are a few instances where a couple of people that I know who previously, for example, worked in psychiatry, and they managed to get some locum opportunities from that. There is one possibility of a locum opportunity within radiology for ST1s, and that's contrast covered. That may or may not be available where you're working, but essentially you're there to supervise the contrast list and be there in case a patient was to have a contrast reaction. And lastly, in terms of savings, so there's quite a few things that you can claim on. One of them's excess travel. So if you are placed in a hospital that's not your primary central hospital, you can claim travel expense through your deanery. Study budget, again, this depends on which deanery you're in. I believe in Leeds, we've got a international budget of £500 that you can use once in your 5 years. And in terms of national budget, I think it's around 700 for 1 year, but they are quite flexible depending on how many people have used that pot and what you are asking to claim for. Everyone should have a blue light card, as that gives you access to a lot of NHS discounts. And you can also claim for relocation if you're moving in from out of area for your radiology training. And essentially have some financial goals, review them regularly, just to make sure that you're on top of things. In terms of HMRC reclaim, we can claim tax rebate on things like GMC fees, indemnity cover, exams that we pay for. And what I've recently found out that we can also claim tax on excess travel. So for example, in Leeds, we only get paid for excess travel anything over 17 miles, which you may think isn't the best. But what you can do is for the first 17 miles, you can claim tax back on that when you do your HMRC reclaim. One of the best resources that I've come across in terms of finances, managing them, is Medic's Money. There are a couple of, I think the 2 GPs, one of them who was a chartered accountant previously, they have podcasts, YouTube videos, and just a lot of guidance on how to be financially savvy, essentially. But what I would say is ultimately don't work too hard to earn, especially in your first year. Focus on learning and improving your diagnostic skills, because ultimately they'll help you be a better radiologist. And once you're done with your exams, there's a lot of locum opportunities within radiology. So now I'll talk a little bit about the academy structure, which Leeds is, and training in general. So the main difference between academy and traditional is that academies have more dedicated time for teaching. They have less clinical days, and the curriculum's quite syllabus-based. One of the downsides, I guess, is that it's not a true representation of your day-to-day work. For example, in an acute CT session, you'll have a lot of CT heads which are pretty much normal or have chronic non-significant findings. Whereas, for example, a neuro teaching session that we'll have 6 to 8 CT heads, which pretty much will all have some sort of pathology. However, the good side of this is that in the academy setting, we tend to see a lot more pathology, which I guess prepares you well for the future years. The academies that I know of in the UK, Leeds is one of them, as I said, Peninsula, Norwich, South Wales, and Northeast are the academies that I'm aware of. There may or may not be some more. I think Northwest is also an academy now. So moving on, so in terms of a bit more information about Leeds Academy itself, it honestly has an outstanding learning and supportive environment. In ST1, we have 3 days of academy, followed by 2 days of clinical work. And the facilities are really good. We've got some excellent teachers who are top in their subspecialties and leaders in their fields. And we have IR facilities like simulators and ultrasound machines that we can go and use 24/7 really. And there's a lot of focus on ultrasound teaching, essentially because once you start ST2 and you're on the on-call rota, you're expected to cover out-of-hours ultrasound, which includes pediatric ultrasound, neonatal cranial ultrasound, vascular ultrasound, gynae, testicular, as well as intraoperative transplant ultrasound, looking at hepatic artery patency, and also managing post-transplant patients in ITU. We also have a lot of supervised reporting where we set cases and then given time to report, which is then followed by individualized feedback and a teaching session on the Friday of the week. So this is some of the facilities in the academy. So we've got a suite which has got ultrasound machines. As I said, it's got some IR simulators as well, and we can bring in our friends and family and practice, even colleagues, whenever we need to. There's a dedicated reporting room where consultants, registrars, everyone reports. We've got a lecture theatre, we've got Max Suite, and we've also got, this is like a communal area where we don't actually have tables and chairs anymore. We've actually got really comfortable sofas where everyone during lunchtime tends to sit down, have a chat, and have a lunch together. So it's a really good environment to be working in. So this is my timetable as of last week. So Monday morning would be my, so Monday and Tuesday would be my clinical days. I'll have my acute CT session on Monday with a consultant, where I'd be responsible in answering calls, vetting scans, followed by an ultrasound list, which would basically, I'd go down to the ultrasound department, pick up any scans, and do them with the sonographers. Tuesday, I'd have another acute CT session, which would again be supervised by a consultant. I'd report scans, send to them, as well as be responsible for answering calls. We used to have surgical meeting on Tuesday morning before the CT session. So that was a voluntary session, but it was a really good learning opportunity. And pretty much every registrar seemed to attend that. In the afternoon of Tuesday, we'd have a plain film session where you'd be tagged with a consultant radiologist or a reporting radiographer, and you'd report scans, plain films, and send it over to them, and then you'd meet up and go through the scans together. Wednesday morning would be the academy session, where would have time, 4 hours for the set cases. So we just sit and report these scans and send it to the consultant, followed by another ultrasound session where this would be the academy ultrasound list. The way this differed from the other one is we'd have a dedicated list of 4 patients with a sonographer, and we'd go through the full list together. Thursday would be another reporting session. So we'd have 2 reporting sessions a week, followed by another ultrasound session, whereas this time would be more focused on ultrasound teaching in terms of lecture-based teaching, and followed by practical opportunity to practice on colleagues in terms of what we'd previously learned. And Friday would be a set of lectures as focusing on the cases that we've reported throughout the week. And especially before part 1 exam, we used to have regular anatomy and physics teaching. And following the exam, we had more teaching geared towards preparing for on-calls, dealing and reporting with trauma scans and so forth. So I'm just going to talk you through a few expectations that are expected of ST1s. So in an acute CT session, you're there to answer calls and vet scans, essentially. You have supervised reporting where you'd pick up a scan report and send it off to the consultant. You would also, so Leeds is a major trauma center, so we'd have trauma scans coming through where you have to do a primary survey whilst the patient is on the table. Initially, I'd have a senior registrar with me who would talk me through things, how to approach primary surveys, and then slowly you gain independence and you'd have someone just looking over your shoulder, just make sure that you're getting some time to take the ownership and start practicing for your own calls. And obviously you have to prepare for the on-call exams, which happen after part one. In terms of expectation for the ultrasound, initially, you're expected to learn how to operate the machine, the basic things, the technique used to obtain images, and what images need to be saved. So for example, myself, when I initially started, I was only able to scan a couple of organs, for example, say kidneys and pancreas, and then I had taken enough time, so then the sonographer would take over and carry on with the rest of the scan. Over time, when I practiced more, I was able to complete full scans with better time management, essentially. However, still having a sonographer supervising me directly. Once you have your ultrasound exam and you start feeling more comfortable, you can start scanning independently with indirect supervision, where a sonographer would be there to troubleshoot if you have any issues, and just double check your images and make sure that you are okay with everything. As with any radiology, you need to start learning how to identify normal anatomy and what it looks like in the different modalities, and also how the common pathologies are seen on imaging. As with any ultrasound, you need to, at the end of the scan, formalize a report which gets published. So you need to learn how to put your imaging findings through that. And you also, in the back of your mind, you need to keep your ultrasound assessment and start learning and practicing for that as well. Then in terms of plain film expectation, initially you'll get a lot of teaching. Well, we did anyway in Leeds on MSK, teaching of different joints, as well as chest plain films. And then, as mentioned in my plain film reporting session, I was attached to either a consultant or a reporting radiographer. We would get allocated some scans, which go and report, and then you'd go through the scans together, just double check the findings before releasing the report. And again, you'll have an exam for plain films before the on-call starts. So you need to start preparing for that as well. As with these exams, I would say that probably start focusing on them after part one, because before part one, that's the most important thing to focus on. My experience of Leeds, it's an excellent place to train. It's got a very good balance of study time that you get versus the clinical time, as you guys have seen on my timetable. You have excellent exposure to a lot of major and serious trauma, a lot of complex cases, ranging from, post-operative abdomens to post-operative neuroscans. You'd also see a lot of day-to-day common pathologies. And Leeds is a transplant center for pediatric and adult liver and kidneys. So you get a lot of exposure to these complex cases. We have very supportive seniors and peers, so you always have someone to ask for help, and the learning environment is absolutely excellent. And as mentioned, we get a lot of time to study, focus on the exam, and once that's over, then you start focusing more on clinical work. So I know there's a lot of information already, but in conclusion, essentially, aim should be to pass your part 1, start building some strong foundations in different modalities of imaging. And from my experience, the main thing is that turn up on time, although you've got minimal expectations, be there on time, be there early for your colleagues if you're taking over acute CT sessions, as they will really appreciate that, and show enthusiasm. And I think that's it from me. All the best with ST1. If any of you are coming to Leeds, come and say hi to me on Thursday in the academy. I will be there. And if you guys have any questions, here are my contact details and feel free to get in touch. Thank you.
Thank you, Salman, for your wonderful presentation. So next we have Dr. Jaren Varghese, who will be covering portfolio essentials today.
Hello, hi, am I audible?
Yes, you are, thank you.
Oh, thank you. Thank you guys for having me. So let me just share my screen first. So, yeah, can that be seen by everyone?
Yes, we can.
Yeah, thank you. So, hi guys, I'm Jaren. I'm the Midlands with University Hospital Birmingham. And so once again, massive congrats to all the guys who've made it this year. Welcome to the dark side is what I would say. So we don't have a lot of time. So today I'm going to talk about your portfolio, which is known as Riser Advanced. It's formerly known as Kaizen. So it's too massive and vast to explore its full functionality. So what I'm going to do today is what I did, and it's going to be a quick stop tour of your e-portfolio. You can use this as a mere guidance, just a starter. I'm sure you have your seniors and your local ways of doing things. And also, finally, I will be talking a bit about your AICP, which is your annual review of competencies progression, which is the last final thing that you have to do with portfolio. So to start with your portfolio, so what I'm going to do is I have my slides as well as I will be going on to my portfolio. So I'm going to intermittently using few things to let you know how to do certain things. So these are the basics which I got from the RCR website. So the things which I'm going to focus on today are these ones. So to start with, just a quick intro of your dashboard of your e-portfolio, which I'm assuming a lot of you would have access to by right now, and talk a bit about the supervision aspect, and finally speak about the assessment and evidence. So to start with the basics, what I would say is I'm going to go over to yeah. So as you can see, when you log into your Kaizen portfolio, this is what you would see. So as I said, this is your dashboard, like your car. This is where you can play around with anything. Quite ironically, I think Kaizen decided to play up for me, and there is some technical glitch happening. I can't see my goals, which you can see in the right side, which I've set, but it's fine. We'll go ahead with that. So this is a dashboard, and this is a timeline. For me personally, I felt timeline is something which you see over time, like when you do some assessments and when you go back and try to check, okay, what I've done right now, what are reflections I've done. So that's what before. For me, this is the quintessential button in your e-portfolio. It's basically create. For each and every assessment and each and everything what you do, you have to create all of this. So as mentioned in the talk, we're going to start with your personal training and your details in portfolio. So when you go over here, you have different sections. This is where you basically set your training details, your name, your rotation across, your rotation supervisor, your clinical supervisor. I cannot show it due to privacy details right now. And this is where you set that. And this is where you assign your educational supervisor. Something which was very puzzling was, would you assign your clinical supervisor? And I'm sure by now you know that you would have two supervisors. One is your educational supervisor, who's going to be the same for the 5 years of your training program. And then one would be your clinical supervisor, which can change across every clinical rotations that you guys are having. For some people, depending on the junior, it could be 3 months, 6 months, or 9 months. So you just need to set. So once you have set your educational supervisor over here, this is basically where you set your clinical supervisor, you choose the date of your clinical rotation, and you just assign and you submit based on the grades. So that's how you do your clinical supervisor bit. And so that's how you do exercise. The next thing is your goals. So goals are basically, you need to create in your portfolio, what are you planning to do for that particular year? So as you can see, that is that. So goals, I would say, again, you can use the create button, but this is what I've created my goals. This is quite expected of an ST1. So as we are focusing on ST1 right now, of what are the goals, it can be divided into 3 categories. This is what we have done in our deanery. One is your grade goals, as you can see, your ST1 assessment goals. Then you use your clinical rotational goals. That varies, as I've mentioned earlier, based on how many months of clinical rotations you are getting. And if it's blocks, then you can set according to that block. And the last is your PDP goals. That is pretty much your personal development plan and your portfolio. Every trainee in NHS need to have a personal development plan. So these are the things which we have been using previously conventionally. So we just copied that. So to give you a small example of what a PDP looks like personal development goals, as you can see, there are a lot of topics here. To give you an example of what a PDP looks like, as you can see, this is just a generic example what we have got from your seniors in terms of clinical knowledge. This is what you can write. There is no steadfast rule that you have to follow a certain way. You can modify it as per your wishes. What is your expectation of your clinical knowledge starting ST1, and what are you planning to do for it? Evidences you're going to show at the end of the year. The next is your clinical skills. What kind of skills are you planning to acquire in your first year in terms of reading, packs, anything? So that is that thing. So this is basically your goal. I'm pretty sure your seniors would be the who can showcase their portfolio as well, so that you can guys help to chip in this thing. Now, the next thing is, once we are focused on the goals, let's go into assessment and evidence. So e-portfolio is basically an evidence library of what you have done over that year, so that at the end, your supervisors and the ARCP panel can have a look at it and say that, yeah, this trainee has gone through everything and he's eligible to go into the next year. What is expected of him in ST1? So the most important assessment, what you have to do is work-based assessment. So I just want to start with that. So these are the few things. And how do you create, as I again mentioned, you just need to go into, this is going to be your button. You go to create button, and if you go over here, you'll find all the workspace assessment in your assessment evidence section. So you press any of those ones and you choose your date, you give some details, you send it to a person who have assessed you for that. To give you a quick intro into what these 2 most important ones are, which is RAD-DOP of the assessments that you do, it's basically radiology, observation of your procedural skills. It's literally a senior person who is with you, who is accompanying you in a procedure, is trying to assess you based on how you do it, how you approach the patient. Are you using any safe technique? What is your knowledge of your anatomy? And it could be an ultrasound guided biopsy. It could be a drain. It could be handling a fluoroscopy machine. It could be even be using your PACS workstation. Yeah, I thought it's very funny, but it's not. You need to be quite good with using your PACS workstation. That could be a RAD-DOPS as well. So that is one of the things. What is expected of you if you use one of the important work-based assessment is mini IPEX. It's basically an interpretation exercise. Again, in your cold reporting session, be it plain films, be it CTs, you go through a few of the reports, you assign it to a consultant or a radiographer, you go and discuss with them, and they basically give you an assessment about what your understanding about the imaging is, the anatomy is, and how well is the articulation of your reports. It's basically an assessment. Is that you start both of these assessments quite early. It's because it's good to start in a lower level, and over the year, it's good to show progression. Try to go to the same consultants and the same radiographers as well, because they can see a difference in you. So once you start right now, you'll be starting at quite rock bottom. Over the year, over the months, and towards the end of the year, you can show an improvement. So that's how you get your numbers. So when your supervisors have a meeting with you, they can see that when you have started, it was quite low, and over the months, you have been improving. And the next thing which I want to speak about, feedback. It's quite important to get feedback from your colleague, and this is what I said. You get a minimum of 12 at least for 1 year, and these are the few people who you can use. People those who work with, and people those who are in training. Anyone can use. So basically, to guard you. thing to remember is you need to get it from people, those who are non-medical as well, as you can see, clerks, secretaries, medical secretaries, anyone. That is one of the things which you need to also focus on. So this is what you would see in RCR website. I'm going to put the reference towards the end. So I've created a small basic thing of what is over here. Here you can click the buttons, you can go through everything quite elaborately, which unfortunately we don't have time for. Now let's talk about your ARCP. As mentioned initially, annual review of competencies progression towards end of the year. Your supervisors and an ARCP panel go through your e-portfolio and they look at it, and they expect each trainee to have certain standards. So when you focus over here, this is what we call as the decision aid. This is what they're going to use to compare your portfolio with. Just focus on the ones on the red bit. This is what is expected of an ST1 when towards the end of ARCP. Like we spoke about mini kexes and rad dops. You need to have at least a minimum of 6 as per RCR curriculum. 1 teaching feedback. You need to have 2 teaching observations, like who have taught, you got the feedback you need to upload as an evidence. So, and you need to be a part of an audit or a QIP. And these are a few generic quips, and obviously you need to pass the FRCA exam. This is expected of you from as per RCR, but this can vary based on which deanery you are. This is West Midlands deanery, so they basically doubled everything. They did not go for 6 mini pexes or 6 rad dops. They expected us to get 12 and 12, which is what everyone has to do. So that is what's expected of us. And also, towards the end of your ARCP, you might see that your education supervisor, in his education supervisor report, that is what the ARCP panel goes through. It saves them time because that is a reflection and a summary of what your year's work. He has to assign you these progression grids. For ST1, again, focus on that one. You're expected to get these numbers for every. So SIPs is basically competencies in practice. There is some generic skips and there is some specialty specific KIPs. Specialty specific is more towards your next years when you do certain specific specialty blocks, but you focus on the generic KIPs. Now, this is what is expected towards the end of your ES report. He would have option to mark you based on this areas. You need to make sure that he marks you these specific numbers. I'm going to show you something. So this is what each numbers represents. As you can see from the previous table, most of the ST1, you're expected to have 2 or above. The only one section where you're expected to have 1 is over here, which is MDT, which they don't expect you as an ST1 to effectively contribute in. Most of it should have 2 and above. For an example, I've heard from a senior trainee that one of the educational supervisors did not know much about this and assigned them 3 for this one particular thing. That is basically you need to have the core professional values to work in NHS. It is expected that all of us would have that. He did not deliberately do it. It was an unintentional mistake, but that cost him trouble in ARCP because ARCP panel expects each trainee to have these number of progression grids for each specific things. So while you have your meeting with ES, make sure that if he's happy, he's putting these marks for you. Okay, so these are the ones which I believe is quite quick. And also one thing you need to make sure is that when you have your meetings with your supervisors, some of the new and young supervisors, they know quite well about the portfolio and how to work around. But some of the senior supervisors, mostly ESs, they don't know how to work their way around. So you have to be quite careful with them as well because they have to know what is expected of being an ST1. So for some of the, especially academy-based deaneries and all, we are really non-existent for them because we don't contribute to the workforce. So we are just here for training purposes. So it's quite important that you make sure that your supervisor is up to date with the portfolio as well. So that's a quick stop tour about the Kaizen e-portfolio. And also this is one particular website. I'm going to put this on the chat. You can just click this thing and it is expected of a trainee to work their way around portfolio. They are quite helpful. So I've almost gotten back answers from them within 48 hours in the most of the time. So if any kind of technical issues you're having, which I had a lot and a lot of trainees do have, some of the documents might go missing. You might not see a few things here. There might be a few technical glitches. So mail them. And also they have weekly live and support functions. So just in short, guys, so it's basically using portfolio to assess your academic work. There's also a good chance for you guys to see how good I'm doing, how bad I'm doing. Do I need to focus on certain areas? Like you might be doing good with your mini kexes, but I'm quite lagging behind on laptops. You need to work for towards that. Also, good advice is start doing things from beginning itself. Like as I said, it's a good practice to show improvement over the year. Like it's not good, you get quite good ratings towards end. You need to show a progression because that is what is expected of you. One important thing which I forgot to mention initially is logbook. Each deanery would have it in a different way. For West Midlands, they gave us an Excel document. We need to store what we have done in it, like how many CTs I've observed, reported, how many ultrasounds I've observed and reported. So what happens is towards end for the RCP panel, you save this logbook and you upload it into the portfolio as well so that they will have a look. So guys, these are the things which I feed as a quick rampant tour of the e-portfolio. The video will be recorded so you can go back and have a look the next time as well. Thank you. Looking forward to any questions towards the end. Thanks.
Thank you, Jaren, for your lovely presentation. So next we have Dr. Jian and Dr. Nat, both are ST2s in Thames Valley, and they will be covering radiology reporting and resources today. Thank you.
Hello, good morning. Can we all hear me?
Very faintly.
Oh, sorry, can you hear me better now?
Yes, thank you.
Great, okay. So this is radiology reporting resources, and this is done by myself, Dr. Jian and Natakan, and we're both ST2s at Thames Valley. So the first thing I wanted to talk about was the plain film reporting and the in-house test that is quite common for deaneries. My advice would be to have a reporting structure that you do for every single scan. This extends to both ultrasound and CT as well. And this means that when you get faster, you automatically look at the whole scan and you'd never miss anything. If you get distracted, you never miss anything because there's a set routine you do it. It also frees up sort of thinking capacity to focus on what you are actually looking at and deciding if it's pathology or if it's normal, rather than focusing, or have I checked that part? Have I checked that part? The next thing I will say is to know your anatomy very well. Now, anatomy is super key for radiology, but in plain films where there's often lots of overlap and interface between different structures, knowing your anatomy means that you can work out what these odd shapes and lucencies are. And then when other clinicians ask you, oh, what is this thing on their x-rays? Is there something to be concerned about? That's how you can really add value, by explaining if it is something or if it's not, and then saying what it is. The way Thames Valley plain film worked was that we would report from a big batch, like a pooled batch, and then we would get them checked initially at first. And it's very easy when you're reporting on your own to sort of blast through 20 or so x-rays and just say that looks normal, that looks normal, that looks normal, and then get that checked and wait for your supervisor to look at them. But I think it's more helpful to think of some goals you want to achieve in these x-rays, because not long will you start reporting them independently. So some things I found helpful was thinking of for the first week or 2 weeks to look through the anatomy, make sure you're very happy with that. And in the second week, make sure I can identify all the different projections and shapes and different structures and explain that. And then when you get better, you can think of the different pathologies and you can explain that, see if you can explain why the shape is that way and that forth. And then if you come up with specific questions, it's helpful to sort of note them down in your report as well or a piece of paper. So when you do your supervision, you can then ask them specific questions. And then lastly, I'd say seek out support. So we were all given a supervisor to help us with our x-rays, but not all supervisors are happy and comfortable in all the aspects. For example, PEDS MSK is something that some senior trainees might not be so comfortable reporting. but this is something that you would be expected to report as well, especially at the junior level where it's more general still. So be mindful of the types of plain films you're picking up. If you find yourself just picking up only sort of young adults, then you might want to think of doing more peds and more elderly population. And if your buddy or supervisor is not happy to go through them, then just to speak to someone else who might be. And also, different senior trainees have different interpretations of different things, so it's always helpful to have a different perspective. And lastly, with the in-house tests, now this was super scary for me during ST1, but I would probably say it's not a very high stakes exam. Sure, you want to pass the exam, but failing it is not be or end all, and it's not like you'll be a terrible radiologist. If you do fail it in that situation, you can always look at the opportunity as you have more time for learning, more time for feedback, and more time for teaching. I know in my scheme, it's not uncommon for trainees that who passed it first time, and we sat the tests in December of ST1, so we only had sort of 2-3 months of plain films before we sat the tests. And shortly after the test, the buddies were saying, "Oh, you're independent. You can report by yourself." And then the support then drastically decreased. Oh. So I'd say if you do fail it, it's not the end of the world, but try to look at what happened, what mistakes you made, and try to fix that for the future. So these are some resources I found very helpful. The first one is this Red Dot Radiology course, which I think many people know about. I know we were given a book, the sort of Red Dot book, that I used as a reference, but also they have a course which the study budget covered, and I attended that, and I found that very helpful. This for mostly sort of A&E, MSK plain films, typical things like fractures. And the next resource is a website run by a group of Dutch radiologists, and I found the MSK and pediatric sections very helpful there, particularly things like ossification sensors in pediatric plain films where you're not quite sure if that ossification sensor is missing or if it's too big or if it's too small for that sort of time age period. And I found that resource very helpful. So the next thing I wanted to talk about was ultrasound. I think ultrasound's quite varied in how it's taught across the country. And in my deanery, at least, we get a 2-3 month rotation. And then we have minimal ultrasound until ST2, where we go on the independent list. So I'd say it's important to think of what goals you want to get and be very sort of mindful of how you approach your ultrasound training. So I think the first thing to work on really is the hand-eye coordination, orientating yourself with the machine, knowing what button to press, and having like a systematic way of panning through all the organs for a specific scan to make sure you have done a very thorough assessment and you haven't missed anything. And then once you're comfortable identifying all the organs and not using the machines, I'd say work on identifying and recognizing different pathology. Different things have different for example, some pathologies we recognize that like gallstones have artifacts, and you can tell that from sludge. And it's things like that that you should be working on sort of at this time period. And the next thing is to actually write the report, to think about the language that is used, to think about how you want to convey your confidence and your seriousness of what you're seeing on the scan to the other clinicians. One thing that was told to me was that ultrasound is very subjective based off the person doing it. Therefore, what you write can be interpreted differently by another clinician reading it. So you have to be very mindful of the language you use in terms of playing up or sort of minimizing what you see to get your point across based on what you're seeing. And that's where the clinical aspect of it is important. And in terms of the list, so we had an option of going to sonographers, senior registrars, or consultant lists. And I would suggest that when you're first starting, you start with the sonographers because they're very good in giving a very structured approach to ultrasound, and they're very good at taking good images. So when you're starting, you want to make sure the basics is very strong. I recommend with the sonographers list. And when you get a bit better and you're able to recognize more in your hand-eye coordinations better, I would suggest going to the doctor's list, which typically have more complex patients and often shorter time slots as well. So therefore, there's more pressure to be able to carry out a slick assessments. And I think that's when you can get more value in training when you're a bit better going to those lists. One thing that was also taught to me was that ultrasound is not just for diagnostic purposes. Sure, you want to be good at it, but you also want to develop the hand-eye coordination for procedures. So needlework is also part of the core curriculum these days, and everyone is expected to be able to do some basic procedures. One thing, so when I did ultrasound, when you're first starting, it's very happy I'm happy to find the spleen, I'm happy to find the left kidney because it's hidden by ribs, and you're satisfied with the image, but it helps more if you think about being able to position your hand carefully between the ribs to sort of optimize the image, because you being able to keep your hand still in those scenarios helps develop the skills to keep your hand still for doing procedures when you have to put needles in sort of small areas if you're going into the liver or if you're going into the pleural space. So think of your diagnostic ultrasound time as also practice for your interventional time as well. And I said the last thing to really think about is to practice. I mean, it's all very well to talk about ultrasound and the theory behind it, but it is a practical skill, and you just have to do it again and again and get better at it. So this resource, it's a YouTube channel, was great for me in terms of recognizing different pathologies. They are short, sort of 10-minute videos of different organ systems, and they just show you the basic images of what different pathologies look like. So I found this really helpful in terms of recognizing different pathologies. And then when I went to my list, I could say, oh, that is cholecystitis. Oh, that is portal vein thrombosis of that sort. And it became much easier in terms of recognizing pathology. I don't know about your deanery, but in my deanery, the things that we absolutely had to focus on first was the abdomen, kidneys, and testes, because that is the majority of the bulk of our scanning for the senior years. So it's worthwhile speaking to your colleagues of what scans you should focus on to make sure you're very good at that. But then also remember that you can scan like almost every part of the body in ultrasound in some way or another. So you should focus on developing as broad skill set as possible, but making sure the core skills are really solid and concrete. I'll hand you over to my colleague Nat now, who will continue with the rest of this section.
Okay, thanks, Jim. I'm going to continue talking about other different modalities. So starting off with cross-sectional reporting. Again, it's very important to have a strong basis in anatomy, and this is what we want to emphasize a lot, as it's something you have to do and redo over and over again, and perhaps refresh it again, as it's unbelievably easy to forget. Starting off with studying for anatomy during part 1 is a really good start, and you'll find yourself throughout your early years, if you're like me, memorizing the liver segments or the lymph node stations over and over again. It's good to have a strong basis of what's normal so that you'll recognize what is pathological. And in terms of the foundational pathology, you'll want to know the things you'll see routinely in your daily work, the bread and butter studies, as well as things that are acute and that you don't want to miss. It's important to go through the on-call scans. In our deanery, we have a 3-month block of acute CT where we sit next to our consultants and go through the acute scans that are coming in from A&E and from the wards. So that's a good way to start learning to get stuck into reporting. You can also go through the on-call scans when you come in first thing in the morning to see what's going on throughout the evening and see how it's being reported. And apart from going through the cases, it's important to read up on these cases as well to understand the physiology and the pathology and solidify how it's presented in imaging. Jen talked a bit about developing a search pattern, and as well as in ultrasound and in plain film reporting. It's very important to have a systemic approach in cross-sectional reporting. I find this book search pattern very, very useful, especially going through the different studies. You may not know exactly what to look for in the beginning, and it's important to always have review areas, especially when there are a lot of things going on within the study itself. You may start getting lost and you may be terrified of what to look for next. Or during on-calls as well, when you may be constantly interrupted by phone calls or by questions, you know exactly where you left off and you don't get a bit lost in reporting. So next slide, please. A bit about fluoroscopy as well. In our center, and I believe in a lot of centers, the majority of fluoro studies were done by radiographers, and they are essentially your best friends during this rotation. Radiographers are usually very protocol driven, and it's good to learn from them in the beginning, as you learn the step-by-step approach. I believe a lot of us are new to fluoro studies. It's important to familiarize yourself with different protocols in your department, as well as the fluoroscopy equipment. And again, anatomy is very important. I find that navigating the fluoroscopy machine, it requires a lot of hand-eye coordination, a bit like driving. So the only way to get good and to get better with it is just to keep practicing. Next slide, please. These are some of the general resources that I found very helpful in my ST1 year, some of which I've revisiting all the time, currently in the beginning of ST2. So Core Radiology is a great summary textbook. It's concise, there's bullet points and diagrams. Everything's quite easy to follow and to digest. And I suggest that at the beginning of a new rotation, it's helpful to do a bit of background reading to familiarize yourself with what you will see during your rotation. And as well as what I mentioned earlier, when you see cases or pathologies that you may not come across before, it's important to read up on a textbook such as Core Radiology. Mini Atlas is something you may have also come across before. They are a collection of classic and common cases that may come up in your everyday practice. And the book, Top T Differentials, this is one of my favorite books of all time. It's an excellent book for going through the different cases. Each page will represent a single finding and the most likely diagnosis, as well as brief descriptions and pearls. Okay, next slide, please. As well as books, some people also enjoy online cases and learning in a more immersive manner. These are some of the resources that are available out there. Radiopedia, I'm sure a lot of you have heard of, as well as Case Stacks, Navigating Radiology. These provide some bread and butter cases with DICOM images and web-based packs. You can go through these scrollable unknown cases to help prepare yourself for on-call as well. Some of these resources are available through your training scheme, and some are also available for free as well. So these not only provide a collection of cases, but also explain the findings and provide a sample report. And I find going through these very useful as an ST1. Next slide, please. These are some of the on-call courses that I've come across, some through specific deaneries, like in Southend, and some through Radiopedia. So these could be helpful during the preparation for your on-calls. In different training schemes, on-call starts at a different time. In my training scheme, we go on a junior on-call from ST2 onwards, where we'll be put on the phone duty, but also will take part in reporting. And so it's good to be familiar with some things that will come up on call as well. And in a lot of training schemes, the senior registrars will provide some on-call teaching, which is very helpful, and they'll pinpoint what you'll likely come across and how to approach them. So that is my part in terms of approaching the general radiology resources. Thank you.
Thank you, Gian and Nat, for your amazing presentation. Next, we have Dr. Afan Saibuddin, also one of the ST2s in Thames Valley, and he will be covering Maximising exam success today. Thank you.
There we go. Hi everyone. So I am Afan. I'm one of the ST2s from Thames Valley. Hoping everyone can hear me. So today I'm really talking about maximising success in your exams. And what I'll cover is just going over the exams in general, what to expect from the exams, then briefly talking about some resources for the anatomy exam, and then the physics exam as well. So let's start off with that exam overview. So in terms of the exam, there's two parts to it, physics and anatomy. And for many intents and purposes, they can be thought of as separate exams. You book them separately, they're on separate but usually consecutive days, and they're marked independently of each other. So if you unfortunately fail one exam and pass the other, you'll only have to resit the one that you didn't meet the pass mark on. You don't have to resit both of them. In terms of the anatomy exam specifically, this is all about recognizing anatomy on a single slice or a single image. There's no scrolling through the CTs or the MRIs, and it does cover a range of modalities. One thing to note is that it includes normal variants as well, but there will be no pathology, so it's important to learn those normal variants. There's also no negative marking in it, so if you're not quite sure, it's still best to give it your best shot to at least describe what you're seeing. That might be enough to give you a mark, but if you don't put anything on there, you're not going to get a mark for it at all. The physics exam is a bit more of a simpler setup, but often thought of as harder to prepare for. This is a set of true or false questions. So there'll be a main stem and then different subsections to that main question. Again, there's no negative marking in this. However, the questions are often a little bit tricky, so make sure you read the question carefully. This is probably most important in this exam compared to other exams that I've sat. Before we actually move on to the different resources, I just want to have a brief disclaimer. I don't have any affiliations with any of these resources. This is not meant to be a definitive guide to every resource. I'm sure you'll be able to find lots more that could be helpful. And I'm also not aiming to rank any of these resources over or below another one. Also, keep in mind, you've all passed lots of exams to get here. You are all good at exams. So keep with what your normal approach to exams are. This is hopefully just to point you in the right directions to resources that me and my cohort found quite useful. So let's start off with anatomy. Again, this is the one that most people think is quite easy to prepare for. It's not an easy exam per se, but the preparation is a bit more simple. The first thing that I think all of us used in my cohort, if not most of us, was this thing called Radiology Academy. So this can be thought of as pass med for Radiology Academy. It has a range of questions that are quite hard to quite easy. But I think the most important and useful thing is that the marking is quite similar to the actual exam. Also, it separates out different questions based on the different anatomical areas, so you can identify your weak points and try to target that a bit more in your revision. This thing is not free. I think it was like £50–60, but I found it very useful. It's up to you to make that decision to see whether you think it'll be helpful for you and whether it'll be worth that investment. There are some other resources as well. So Radiology Cafe, which I'm sure all of you have heard of, have mock anatomy exams. Most people that I've spoken to say that this was easier than the exam, but also most people I've spoken to have recommended to do all of them. They have about 16 or 18, I believe. And again, they are similar to the exam in terms of how they're set up. And yeah, I would definitely use this as a resource. Radiology Cafe also do have a page on normal variants, which is quite helpful to look through. And Radiology Vibes, another website, has another page on anatomical variants. There is obviously a lot of crossover in these two pages, but there are some things that are on one page and not the other, so they're both useful. There are also lots of different books you can take a look at. These are the ones that I've come across here at the bottom. The third one across, Weir and Abrams, is an imaging atlas. So it literally is kind of like if you come across Imaos, for example, it just has an image and labels for each anatomical item on the image, so you can see what it is. And the other ones are primarily question books. So it, like the exam, will give you a slice on an image, put arrows to the part they want you to label, and then ask you what those things are. Moving on to physics resources. So most people that I speak to think that the physics exam is harder to revise for because it's a thing that a lot of people may not have done since A-levels or maybe even high school, if that's the schooling system that you were in. One thing that we all used in my cohort and the vast majority of us really appreciated was this YouTube channel called Radiology Tutorials. This has videos covering a large chunk of this physics syllabus. Not everything, but still quite a large chunk. And the explanations and also the diagrams that he uses is quite helpful. There are some further resources linked via this YouTube channel that you can pay for. I didn't do it, some of my colleagues did, and I heard good things about it. So it might be worth you guys taking a look to see if that's something you're interested in. There are some other resources from FRCR Physics in terms of online resources. There's the RITI modules on e-learning for health, and this is based on our RCR syllabus, and this is something you can find for free. There are some other ones, question banks that are a little bit like PassMed, that have different questions and then explanations for the answers as well. These aren't free. I can't even remember which one that I used. The ones that I've seen aren't the most expansive in terms of question banks, but they may be helpful if that's what if you want a question bank to work from. The one at the bottom, PassFRCR, that is free. It's quite basic, but I think if you found yourself with nothing to do, it's helpful to just go through a few random questions here and there. There are quite a few resource books for FRCR Physics. I'll first talk about the FRCR Physics notes, the Radiology Cafe book. So Radiology Cafe have these notes on their website. I do think there's a little bit more in these books. It's quite a simple overview of the syllabus, and I personally don't think it'll be enough as your sole resource, but it's a really good start. The quintessential physics book that everyone knows of, whether they used it or not, is FARS. A lot of people say that this is a lot of detail, sometimes too much detail. So people are in two camps. People either swear by it or say, it's too much, I don't want to be overwhelmed, I'm not going to look at it all. It depends on your approach to it, but it's something that a lot of the question books does refer to, so it may be helpful to at least look into, see if it matches your revision style. MRI physics is, again, one of the things that people say is the hardest to understand. A lot of consultants here say MRI is basically magic and that's all you need to know, and apart from for your exams. So this book here, MRI Made Easy, this has been recommended to me by consultants who have had CCT for decades and some registrars who are just a year or two above me. So it's something that's well known and it's a really good start for the basics of MRI. Moving on to question books for FRCR Physics. So there's no one best MCQ book. They often have errors. So I would use a couple of these books and multiple sources, just so you can cover your bases. The third one along, the Ilyas book, again, this is similar to FARS, often thought to be beyond the level of the exam. Not everyone agrees with this, but that's what I heard. So again, if you want to go above the level of the exam so you can confidently feel that you're going to pass the exam, this might be for you. If you don't want to overwhelm yourself, you may want to look at other resources, and there are quite a few. And just to mention the last one across there, Succeeding in the FRCR, that's an MCQ and reference book as well. There are revision courses for FRCR Physics, and these are the ones that I was able to find. Most people have only been to one of them, so you're going to potentially find it difficult to get a comparative reviews of these ones. The one that I went to, I can't actually remember which one I went to, but it was good, it was helpful. I think all of these will be helpful. It just depends on whether you want one that is more online based. There are some that are in-person based. and some of them have associated anatomy revision courses as well. So take a look through them, see what suits you best. I'm sure they all will be helpful, but yeah, I think you'll struggle to find comparative reviews of them. I'm going to end on a few exam revision tips. So as I've already alluded to before, I would say it's probably better to focus on a few resources than stretch yourself trying to use too many resources, because that might just confuse you. But on the other hand, using just one for anatomy and one for physics probably won't be enough. So you do need to have some diversity in your resources of revision. As I've already mentioned before, these are just a few suggestions. There will be loads of other helpful resources that will be helpful as well. So speak to your colleagues, speak to your seniors. They will likely have some things that I may not have mentioned on this. Take a look at your study budget. So for our study budget in Thames Valley, we could go on the Red Dot course that Jan mentioned, but also an anatomy or physics course. And that was really helpful to be able to go on to a physical revision course. And also take a look at your study leave guidelines in your deanery, because you will have to use study leave for your exams. I used to think it was professional leave, but apparently now it goes away from study leave. And at least in our deanery, we can use some of our study leave as time to revise for the exams. However, most of us did use annual leave as well for preparation time. It's up to you whether that's something that you want to prioritize doing. But take a look at those guidelines, maximize how much study leave you can take, and book that leave early. That's all I had to say. I don't know if we have time for questions at this point in time. I'll leave that to the organisers, but thanks for listening.
I think we'll leave the questions till the end, if that's okay. Thank you, Afan, for your fantastic presentation. And now we have finally Dr. Jake Cowan. He's one of the ST3s in Wessex, and he will be discussing research opportunities in radiology. Thank you.
Hi everybody, sorry I'm on a bit of a delay for some reason. My Wi-Fi isn't the best, so I hope you can hear me. I've put my camera on, but it doesn't look like it's come on yet, so I'm sure I'll appear at some point. Can I just check you can hear me okay?
Yes, we can hear you well, thank you very much.
So a few minutes on research, something I enjoy, but not everybody enjoys, and probably the least of your worries at the moment. I'm on the ST3s in Wessex. Let's see if this will click through. 2 seconds. There we go. So why bother with research? You've already smashed the portfolio, you've smashed the MSRA, you're living the dream now, you're ST1. Why bother continuing to build your portfolio? Why bother with research? Well, the bad news is it's actually an ARCP requirement and a CCT requirement from the RCR. So you have to have demonstrated some interest, at least in a research project over the 5 years to CCT. And locally in Wessex, our ARCP requirement says that you should be involved in research every year, although it's quite lax about what that means, and it can just mean journal club involvement. Why else? Well, you get to explore a subspecialty of your choice. If you like MSK, you can do an MSK project, for example, and get a bit more knowledge and experience there. One of the best things about research is that you get to go to conferences both in the UK and abroad, and there's some pretty big conferences abroad in radiology, which I'll show you in a minute. You can see your work published, which is always really nice. Network with like-minded colleagues. And really importantly, you get to boost your CV for fellowships and consultant jobs. And fellowships in Australia and Canada, for example, are really quite competitive. So that's some motivation for getting involved in research. This graphic is just taken from the RCR ARCP guide. As you can see, one research project needs to be undertaken during training and evidenced in Kaizen, either in the form of a research evaluation form or publication, for example. So how to get involved? Well, the most logical way to get involved would be through a local project. But this requires a little bit of forethought. You need to think about how much time you have on your hands. You know, starting before the FRCR Part 1 exam might be bad timing. Oh, there I am. What is the end goal? Do you want to publish and present your work, or are you looking just to do a small sort of tick box exercise or a larger study? Are you willing to learn new skills? For example, I've learned how to do a meta-analysis over the last few years. Or what skills can you bring to the table for a project? Perhaps the most important step in a local project is finding an appropriate supervisor, and this requires you to do a little bit of homework. So you want to find someone who's got the same research interests as you. Are they friendly and a nice person to work with? It's worth asking around in the department. And really importantly, do they publish regularly, or do they have experience in publishing? Unless you're really experienced in publishing, this is going to be a really useful skill for a supervisor to have a bit further down the line in case you run into any problems. So it is worth doing your homework for a supervisor. But what if you can't find a suitable local supervisor? And I know sometimes it's difficult if you're working in a DGH or a deanery that's not particularly academic, for example. Well, usefully, the RCR produced this radiology research map, which is on the RCR website. And this got a list of institutions and individuals at each institution who are research active in radiology, with their contact details. And some of them say, or a lot of them say, open to EOI, open to expressions of interest, and their contact details are there, perhaps if you want to find a regional rather than local supervisor. So if you don't want to perhaps lead a local project, or there's not many local projects available to get involved with, you should think about joining a collaborative research network. And I hope that you might have heard of Radiant, which is the Diagnostic Radiology Research Network, stands for the Radiology Academic Network for Trainees, or Unite, which is the IR equivalent. And the aim of these research networks is to utilize trainees all over the country to collect data and to produce really high impact multi-center studies. As you can imagine, if you've got 15 trainees around the country collecting 50 to 100 patients, then you've got a really good size study there, which is representative of the whole of the UK, hopefully. And the benefit to these research networks is that each project, if you're a data collector, you should be rewarded with collaborative authorship in the form of a PubMed citation. So this could be quite an entry-level way of collecting some data and getting publications out of it. I'm on the committee, we're also always looking for local leads who perhaps want to take on and first author these large-scale projects with help from the committee. I would recommend subscribing to the mailing lists, for these are both active on social media, and you'll get notified when new projects are available, and sometimes committee positions are also available. This is a nice example of a project published by Radiant a couple of years ago. It was some work performed during COVID. As you can see, the first line is the sort of first authors. Those are the committee members who were involved. And Anmol there, Anmol Ganji Burton first authored it. But then, as you can see, Radiant Group is listed in the list of authors. And if you expand that, you've got all of the collaborators who collected data from that project. Most of those are radiology trainees all over the country, and they were rewarded, as you can see, with a PubMed citation. And they may have only collected about 50 patients, maybe less. If you're interested in finding out a bit more about Radiant, we're holding our annual general meeting in a couple of weeks' time in London on the 24th of September. We've got some great speakers. We've got some project updates from projects that are currently ongoing. Tickets are about £20 or £25, I think, but use that study budget. We've got an unlimited study budget in Wessex for UK courses and conferences. So do use that, and we've got 15 days study leave, which I think is probably the same for everybody across the country. So come and find out a bit more about what Radiant are doing. It would be nice to meet you there, and perhaps you can get involved in some projects. Another way to get involved, and this isn't an exhaustive list in research, are through fellowships. So sort of unique learning opportunities outside of training or alongside training. You've probably all heard of the academic clinical fellowships, which are run by the NIHR. which have some formal element of research attached to them. They run alongside clinical training for about 3 years. Most of them are ST1 entry. We may have some ACFs in the webinar today, but sometimes there are ST2 and ST3 entries, and these are advertised on Oriel around the same time that applications for radiology training go live in October and November. So do keep an eye out for those. If you're successful in being appointed to one of those, you would have to move to that deanery if successful, and they're kind of sporadic. They're based on local funding. Some deaneries more often than not have an ACF compared to others. There are also other unique opportunities. So GSTT and the AI Centre for Value-Based Healthcare have started running a clinical AI fellowship, which is open to all ST3 and above registrars in the country, not just radiology trainees. So it's super competitive. If you're interested in AI and think about doing this in a couple of years' time, maybe start building up some experience with AI locally. And radiologists are probably the best place to do that. And most of these fellows actually are from radiology. You can also get involved in peer review fellowships. So I'm currently a European Radiology Yves Menu Review Fellow, which is a 1-year program where you train to be a peer reviewer for that journal in the subspecialty that you're interested in. So I'm peer reviewing the head and neck manuscripts that come into European Radiology. I'm attached to a deputy editor who's based in Seoul in South Korea, and she gives me feedback, and hopefully at the end I'll stay on as a peer reviewer for the journal. And it's also really good, they funded my trip to ECR this year in Vienna as part of the fellowship program, and there's 10 fellows selected from across the world, so there's 2 from the UK this year, and the application I think opened for that in the autumn time. Let's see if this will move on to the next slide. 2 seconds. There we go. So we've got some key dates for the radiology calendar. This doesn't mention subspec conferences, but sort of general research, big conferences. I've mentioned the Radiant AGM, just because I need to plug that a little bit. But the BIR, which is the British Institute of Radiology, hold their conference every year at the start of November. And that's based at the Royal College of Physicians, and that's a really good 2-day conference with a mix of educational and research presentations. The RCR hosts their own research day on every November or so, and that's online. Worth joining that if you're interested in finding out a bit more about current radiology research. And then the 2 big ones. So ECR is the European Congress of Radiology. Every year it's housed in Vienna, because I think it's the only conference center in Europe big enough to hold it. Over 30,000 delegates last year. And that's at the end of February every year, and really worth going to if you get a chance during your training. And the American equivalent, which is even bigger, is RSNA, which is in December every year in Chicago. It's a bit colder and windier than Vienna, I think, but one that I'm hoping to go to at some point. And then I've mentioned the SRT. Lots of you probably already know about the Society of Radiologists in Training, but they hold their conference every year in May. It moves around where it is, and I skip on here. It's a really amazing place to showcase your research or audit or case reports as a trainee. There's a subspec category, poster prize category for every subspecialty, with really great prizes on offer. And these are international prizes because international candidates, delegates can attend online. It's a hybrid meeting usually. And it's a really great opportunity to win a prize. And there's probably between 3 and 10 posters usually in each category. And there's an oral presentation prize as well. So abstracts usually open for the SRT in February, I think, or around or maybe close in February. So you've got a bit of time if you're doing any audit or research locally to get an abstract in for next year's conference. Finally, just a few pictures from the last year, just to try and showcase that research can be fun, and it's nice to do things with other people. rather than sitting in our dark room a lot of the time. So on the right is all the Wessex trainees at the SRT this year in Brighton, which was good fun. There's me looking chipper with my poster. At the bottom, it's myself and a few of the other European Radiology Review Fellows in Vienna this year. That was a really amazing opportunity. And most importantly, on the right is Vienna's famous chocolate cake, Sacher Torte, I think it's called. And that's a requirement, really, if you go over to ECR. So that's everything from me. Thanks very much. I've popped my email and sort of LinkedIn, X, please get in touch if you've got any questions. It'd be great to hear from you, and come along to the Radiant AGM, and hopefully that's given you some sort of ideas about how to get involved if you'd like. Thanks very much.
Thank you, Jake, for your excellent presentation. Thank you. Thank you to all of our speakers today. The presentations were extremely insightful. So I believe we have some time now to answer any questions that you guys may have. If you guys don't mind just sending the questions in the chat, please. We will also be sending a link for our feedback form. Please fill this out for us if you guys can, as this will really help us make any improvements. Thank you. Don't see any questions at the moment. However, there was a question earlier on the chat that was answered partly by Nat's presentation and Abira, but I was wondering if any other speakers could maybe if they had any recommendations for how they prepared for on-calls.
I think the best way is to do a lot of reporting. And start off with your ST1 when you have your acute CT rotation, in your rota. It's like 4-hour session that you are assigned to. You're with a consultant or a senior registrar, because although you attend how many courses, it's really different when you are in the hot seat. And secondly, the best thing is to attend your local teachings. I know lots of teachings have now gone on Teams, but I still prefer face-to-face teaching because you just see how your seniors, they are approaching a case. Because I remember on our first week, we were just put into the hot seat by a neuroradiologist. And then she said that you can be as silly as you want to be because no one is expecting anything from you. So it doesn't matter what you say. So just start identifying how the bleed looks like, how an ischemic stroke looks like. Just identify normal structures. You would see calcification in the ventricular system, and you would think this is a mass or something. So it doesn't matter. Just try to familiarize yourself with the normal structures, and then once you know the normal structures, you will start picking up the pathology. So there are lots of, I think, on-call courses, but I have not been to, because when I started, just COVID hit, so lots of courses were obviously cancelled for the first, I think maybe for the first 2 years, we didn't go to any course. I think the Red Dot courses, they switched to on Zoom. So all the courses, they went online, but now the courses are again face-to-face. I've been to one BSNR new radiology course, which was around like £50. So and radiology seminars, they also do some on-call courses. But don't spend too much money if you feel it's not worth it. So honestly, you will just learn it on the way. And then the learning course is very steep. When you start, you don't know how to report a plain film, and by the end of ST1 you have started reporting. Apart from reporting, I think vetting is also something which is really, really important, and I think most of the people, they miss it. So by the time you start your shadowing on calls in ST2, your main responsibility is taking the phone calls and then vetting the scans, which scans are urgent, which scans are not urgent. How do you prioritize the exam, going through the primary survey while the patient is on the table. So all those subtle things which you will learn on the way, and then just try to get along with your seniors and see how they are approaching. And I think that's the best way. And I think I learned the best like that, especially in my core years till you pass your FRCR exams. And then once you start into your subspecialty, then it's more like you're focusing on that subspecialty once you have done with your exams. So yeah, do we have any questions? And thank you everyone. The talks were brilliant. Okay, so there are a few questions regarding how to get into radiology. So this webinar is for the radiology trainees who have already started. So Nitin, if you have any questions, we have lots of videos on our YouTube channel. You can go there and watch those. Okay.
There's another question now that's asking how to prevent burnout. As people in the years above are saying that 25%, there's 25% burnout rate. So how do you prevent burnout?
ST1s, do you feel there was a burn? I think it's the most chill year that you can have.
So I'll just chip in. So yeah, ST1, as Avira said, is the most chill year that you're going to have. You have, I mean, especially in Leeds, we had a lot of spare time to, get involved with anything that we needed. But what I've seen from the seniors, from like ST2 onwards, people tend to go less than full time. And the most popular option is 80%. So you basically get a day off a week, which you can essentially use to study for the 2A, or just have some time off. And I think with that, people tend to have a good work-life balance with the 80%. So if you think you aren't getting on top of things, then that's something that you need to consider. But I think you need to plan that quite well in advance, about 4 to 6 months in advance, as some people I know missed out because they didn't speak to their ES and TPD in time.
Yeah, I agree with those. I think something that perhaps we didn't touch on is that ST1's an interesting year because you can go from being quite an independent, maybe surgical, SHO or reg or medical F2 or whatever it is, to being or feeling rather useless as an ST1. Your knowledge is at rock bottom. You can't do anything independently. You can't even find a kidney when you're scanning. And it can be a little bit depressing in that respect and sort of requires you to maybe change your perspective slightly. And that, I think, can lead to burnout with some people. And we've seen that locally there, especially people who are perhaps more senior registrars before come into radiology, and they struggle to cope perhaps with being back at square one. So I think it's really good just to make sure you're talking to all of your colleagues, like we've said, speak to your ES and recognize that everyone probably feels the same way. And ST1's weird because it can be very chilled at 90% of the time and maybe slightly overwhelming 10% of the time. So just an appreciation that everyone's going through the same thing probably is a good idea.
Yeah, I agree. And one other thing is, I would like to mention that always give yourself time, because when I started off, my colleague, and like she's now a really good friend, she has CCT'd with me. And I think for the first 3-4 months, she's kept saying that I think I've picked a wrong specialty and I think I'm going to leave. And she was at the point where she said, I think I'm probably going to resign, and like, I'm going to leave. I think I want to be a gastro reg. And I just told her, like, just give yourself time, because it was just really uncomfortable, hours and hours not doing anything. So give yourself time, and just try to relax, and just try to even like pick up any book if you have any free time, like anatomy books, or go through the mocks. What I used to do was, even if I was in an MDT and if it was going long and long for like 2 hours, I just used to open like Radiology Cafe mocks on my mobile or on my laptop, and then just going through the images. So you're still going through, like if you're sitting in a GI MDT, just scrolling through some images of like anatomy images or from radiology mocks, and just go through like 10-20 of them, so you don't feel like burned out. Sometimes you feel like obviously you're not understanding what's going on in the MDT, but then utilizing your time somewhere else. So give yourself time, and you will enjoy it. I've not heard anyone leaving radiology.
I also want to just add one more thing, because I mean, a 1 in 4 burnout rate is really high. So I don't know what training program that is, but I'm sure there are issues in certain training programs all over the country. And what we have in our deanery is that we have every 3 months or so a meeting with all the registrars and the TPD and the head of schools, so that they can feed things back. So I think maybe having a chat with those seniors about what's actually, if it's more of a senior thing about when things get busy, what's gone wrong, and seeing if there's any way to actually escalate that. Because if that's the only way to change that, because there might be some personal things that some people, like mentioned, may not be used to not having that responsibility or feeling not as helpful. But if it is because the workload's too high, or there's unsupportive parts of the team or the training program, then the burnout rates probably won't change unless there's a change happening there. So if that's something that might be the case, having a chat with other radiology trainees and bringing that up might be the only thing that changes things in the future and makes it easier for the juniors coming at the moment and past you.
Yeah, I just want to add a few things. I think NHS is all about learning from mistakes. So I think if given a chance again, what would I've done better in an ST1 is what I want to say. Two things basically. First is ultrasound is quintessential in being a good radiologist. And so when you start initially on ST1, they might put you, depending on which deanery you are, with the sonographer. So I think a lot of mistake what we ST1s in our deanery did was that we was a bit timid. So, and also people can vary. All the sonographers might not be very supportive. So I think you don't have to stand back, you have to go forward, and you need to do that extra bit, and you need to show quite keen interest in doing things. And basically, as the ultrasound teaching just said, touching the probe, working away with everything. That's the way how you start. So if you are timid and if you expect them to spoon feed you and encourage you, that might not happen. And at the end of the ST1, you might feel like, I actually don't know to do a lot. It's a bits of ultrasound. That is the first thing. And the second thing which I would have done better, just Abira, what she said is that you need to do a lot of reporting in acute reporting and hot reporting. One thing what I would suggest is speak with your senior registrars and ask them, make a list of the different types of scan, what is done the most in your on-call, and have a list. Because when I did few of the acute reporting, it's not like I get a lot of CT heads and CT PAs, and that can be normal. But what I did miss out on was CT intracranial angiograms, CT venograms, certain kind of bowel ischemia or GI bleeding, and these things can come on call. So you might be okay at reporting CTPAs and CT heads, but what you are lagging, you need to know what you're lagging so that towards the end of the year, what you can do is that you can go back into your packs, go to the last 30 days or few weeks, and you can go through on a call session the scans that you haven't reported on call so that you can compare with the report. So I think these two are the things which I would do better if I have an ST1 again, so that you would just learn by your mistakes with it. Thank you, guys.
Okay, thank you. So we'll wrap up.
I don't see any further questions up in the chat. So I think this brings us towards the end of this session. Thank you, everyone. Special thanks for speakers for their highly insightful talks. We learned loads if decided. Before we wrap up, I would like to remind everyone that feedback is important for us. So please do take out a few minutes to fill out the survey. The link has been shared by numerous and around in the chat box multiple times. So please do fill in the feedback. The recording of this webinar will be available on the UKRST YouTube channel. I would encourage everyone to follow us on all the social media platforms, as we have loads more events coming up soon, hopefully. ukrst.co.uk is our website, and it is the hub for all resources. So you can just get our email addresses if you want to get in touch with us. If you have any thoughts, you can always write to us, and we'll be thrilled to hear from anyone of you. Well, I think that's all from us today. I would like to ask the committee members and speakers if they can stay on a little bit longer, and to all the other participants, sorry, I would like to thank you for your commitment to radiology, and have a great day.